Okay, hi. So I'm very glad to present Health Nexus to you, which was my team's project for the Columbia Global Collaboratory. A very quick introduction to our team. We are a very diverse team from GS and CC, studying neuroscience, biology, biochemistry, political science, many different fields. But what we had in common was that we were all interested in public health, and we were all interested in taking a human-centered approach to solve some kind of COVID issue. So Shariq is going to tell you a little bit more about our project.
Great, thank you, Mareike, for the introduction. So great, so like kind of diving into like what our project was all about. So this is just a high level overview, but I would get into like some nitty gritty details so that can expand upon like what went into like making this project, which is also very dynamic and is still in the making. But just to like tell you a bit about like who we are. So Health Nexus is a team of students at Columbia, of course, brought together by the wonderful cohort of like Columbia Global Collaboratory, CGC, this summer. And we've been capitalizing on the rich interface and the collaborative community that this was provided to us by. And our team has been interested in cataloging the endemic responses to COVID-19 in the healthcare systems around the world. So to do this, we have been conducting interviews to collect data that reflects the experiences of medical professionals, but also patients coming from different backgrounds. And this data has been and will continue to be considered in tandem with like different variables that influence the efficacy of like pandemic response. So these include the policies taken, how they have been communicated by different governments, how the public has responded to certain policies, and whether access to healthcare has been equitable or it has not been. So our goal, as mentioned on the deliverables on the slide, has been bivariate. So first of all, we have been trying to highlight and analyze the public health guidelines used by countries throughout the world in response to COVID-19 pandemics, including face coverings, physical distancing, travel restrictions, business closures, testing, etc. And we've been exploring these variables on a continuum, such as like the cultural values of individualism and collectivism in different cultures as a part of our analysis. And in addition to that, our project also looked at, was motivated by our collective interest in just like understanding how different healthcare systems and responses are interacting with local culture, policies, and also insurance infrastructure too from a financial standpoint. Moving on to the second part of our objective or project or deliverable that we're trying to produce. So we recognize that during the COVID-19 pandemic, certain countries experienced significantly more success in dealing with the damaging effect of COVID-19 than other countries. And we were interested in seeing what these countries have done differently to experience the success and what their relationship with healthcare is as a whole is, and how that may have influenced their decision-making system. So it's important to kind of like look at these relationships comparatively. That's what we thought about. That was our motivation, because it can help us like develop like a critical lens for our healthcare systems and highlight ways in which we can learn from other healthcare systems. As we have seen during the time of COVID-19, we are a global community. We are so interconnected, and we have been collaborating on so many projects, such as, for example, like vaccine development. That's just like one example of research that has been going on. But like this just kind of goes to show that there's so many lessons to be learned across borders. And we've been trying to do exactly that, to like develop like a critical lens about how to like better develop our healthcare systems in a more equitable way, and just like highlight like what things can be done better for a larger global community in the future to prevent any catastrophes of nature we've seen so far. Yeah, and handing it over to Mareike to talk about the methodology of like what went to the making of this project.
Yeah, thank you, Shariq.
Yeah.
So the methodology is really a very essential part of our project and kind of what distinguishes it. We were trying to capture the unique perspective of individuals in the pandemic. So these might be healthcare workers, people that really worked in the front line of the pandemic. These also might be people that were very heavily affected by the pandemic. And by interviewing different individuals all over the globe, we wanted to really capture individual oral history in the times of COVID. So these human-centered interviews will be combined with a subsequent literature review, which is more of a more quantitative part. We are trying to leverage the insights we were able to generate through the interviews, and as a way to pinpoint where we should do more research in terms of a literature review. So right now we have conducted a lot of interviews we will continue to conduct more interviews and summarize them in a way that's easy for a reader or a user to understand and kind of really bring themselves into the position of the person that was telling their really unique personal story, or just oral history. And we will soon start with a comparative literature review, and we'll also showcase this on our website. And for the comparative literature review, we'll focus on healthcare system, as Shariq mentioned, different countries' responses in terms of how they reacted to coronavirus and in what timeline, both on a policy level and their consequences, which we can still see today and will see in the future.
Also, there's a typo. It's supposed to be countries, not counties.
Oh,
just in case anyone's confused.
Yeah, countries. This is globally. So we covered countries in Europe, in Asia, and in America right now, but hopefully in the future there will be even more. Handing over to Lauren for data collection.
Thank you, Mareike. So speaking of countries, we already have reached out to 11 different countries. Some of those countries we have talked with a long list of people in. So essentially what we've done so far with the interviews is we've done an oral history, as has been described before. So we essentially, what we wanted to do was collect was basically draw out a plan of, how can we synthesize, like first we generated questions in terms of what all of us were curious about in terms of COVID-19 and global health. And then we condensed all of that into a series of themes, and we were able to create a comprehensive interview template where we could ask high-level questions on all of the themes, and then depending, because we actually reached out to people from all different professions and different levels of healthcare practice. There were even some people involved in administrations. So we wanted to be able to really hear stories from people doing all sorts of different types of work, all converging on the global pandemic. So we had a condensed theme list, which included the healthcare system itself, and that was divided up into policy and institutional structure. So we really delved into that on a case-by-case basis in terms of who we were talking to. We also talked about allyship and advocacy. One of our big focuses was social determinants of health. And one of the things we've had to do is really decide, what does that mean? And does it change based on the specific country or region that we're looking at? So we've really talked about not just access to healthcare, but things like income, education level, citizenship status, and access to basic needs, not just healthcare, but where are the grocery stores nearby? Are people able to get food while they're staying at home quarantining, that kind of stuff. So we've looked at allyship and advocacy. We've also looked at personal experience. So we've asked people to tell them their certain stories that they want to share with us. We've also discussed with people their ideas about global collaboration, which is a very intense topic right now. So we've had responses all across the board in terms of whether people think that's possible, what their thoughts and ideas are, and whether they've actually been involved with collaboration. So go ahead and, Mareike, you can go ahead and go to the next slide.
Yeah, should I quickly show the question bank, which you just spoke about? Or,
sure, yeah.
Okay, maybe that will give, okay, that was missing. Maybe this will give people a better idea of our interview question bank. We did this in 3 different languages, and this is what Lauren just talked about, like comparative health systems, challenges for healthcare workers, allyship and advocacy, and this is an example of the German version. We also have a French one. And hopefully in the future, we will have many other languages. Okay, I'm going back to the presentation. Where is it? There.
That's actually a really good point, because it's been such a gift to have people, you know, who can interview people in different languages in our group. So that's been one of the highlights of our project.
Yeah, totally agree. Oops. Okay. Well, okay.
Okay. So I'll briefly touch on the digital interface, and then we will do a little bit of a presentation of our website. So originally we were thinking that we would do an app, because you know, we are still clarifying what our long-term goals are specifically, but we envisioned a couple of things that we thought about were actually citizens being able to interact with our webpage or our app, which has become a webpage. And we envisioned this being a portal that helps with public education. We really want people of all, you know, on levels of understanding in terms of health, to be able to go to the website and get free information. We would love there to be some type of search function, or some type of, you know, collaboratory aspect of it. We also thought of this being helpful for healthcare practitioners themselves. So we've been really inspired by certain apps that are already in existence that cater to connecting practitioners of different regions. We have arranged our website into regions, so I'll let the next presenter focus on that. And we are consistently, we've done interviews, so we're adding more to each section for that. And then we will continue to build out different sections of the website depending on what we're doing going forward. And then we have a resources section, which I would recommend checking out. It's pretty diverse in terms of what's on there, and we've tried to specify why we're recommending things, or which things are good for which people. And then we also have a get involved section that I would recommend checking out as well if you'd like to communicate with us. So Shariq, I will turn it over to you to go over the website.
Yeah, sounds great. Thank you. I will just share my screen. Thanks, Lauren. All right, so this is the website that Lauren was just introducing. So this is our web page, and where we have been showcasing the stories that we've been collecting. And like we said, this is the parts of the whole. Like, we really have been thinking about this project very globally, and the parts have been kind of divided into sub-regions. And the regions have been Asia, the Americas. We haven't been able to explore Africa as of yet because we didn't have enough stories from there. And the Americas, so that's South America, Latin America, and also North America. So we're hoping to keep expanding our coverage of the regions. And this is just a map of some of our stories. You can see the diversity of our spread, all the way from East Asia to Alaska even. So we have had an interesting collection of stories, and even in South America, we do actually have some from Africa, and some from South Asia, plenty from Europe as well. Kind of just kind of correlates to what our membership base has been for the project, the 8 members we've had, and how they've been able to collect stories from their home countries and home regions. Great. So kind of speaking to what our project has been. So like we said, the project has been divided into regions. So these are the regions we've collected the most stories from, which is why we've had those pages prepared. But just to give an overview of the regions again, these are the 3 regions, and just gives a rationale for why we chose these, or why we segmented our collection or presentation of stories in such a way. And I'll just show you the Americas and Europe. So this is these are some of the stories from the Americas, and we've included audio clips. And of course, we've been very mindful of the privacy of different healthcare professionals and different stipulations that prevent them from revealing their identities in a public forum. So we've been able to include audio clips, and we've included some quotes that have been a significant, that have been interesting to us. Then we thought this would be a good format in revealing and presenting the stories from the Americas. And similarly from Europe, and we can see stories from the front line in Europe. And again, we have a very similar format and with stories. And we are really excited to continue doing this, to continue like expand, adding more stories to each region, and even adding more regions, like we mentioned earlier, as we continue diversifying our spread. And the team page, of course, is that was already talked about with Lauren. So that's me, Lauren. We have Mareike, the ones who are on the call right now, and we have Patrick, Radhika, and Chris, who will be presenting just after me. And we also have Tanya and Merchant, who could not make it to a call, but who have been like excellent team members in making sure this project comes to fruition as it has. And yeah, the get involved page, the part like we would love to have more team members on our team. Like we said, we have really leveraged the strength of our team. We have leveraged the fact that we have such a global spread, and we have leveraged that to our strength in collecting stories from a very diverse spread of regions. And we would love to have members from all over the world. If you are excited to get involved, if you're interested in public health advocacy, how the pandemic has affected healthcare professionals, especially, and even patients from a psychological point of view, like please do like reach out to us via this forum, and we'll be excited to continue collaborating with you. And that is all for the website, a very like high level overview of our website. But we do also encourage you to visit our website. So that's like columbiahealthnexus.org. And you can check out some of the stories, and you can click on the video, audio clips, and like read the quotes, whatever is you deem best. So thank you. I will just hand it over to Chris, I think, after Mareike shares slides again.
Yeah, so our website, though a very important part of our project, is not the only item we have been working on. We have also been conducting a literature review of different scholarly works and journalistic articles to inform our understanding of the world response to COVID-19. We are planning to potentially work on a research paper that will be analyzing responses to the coronavirus pandemic from countries all around the world. We are planning to frame our research around the United Nations Sustainable Development Goals, especially the third one, which is about good health and well-being, and the 10th one, which is about reducing inequality. We believe that these goals have been, are, and will be highly and negatively affected by the ongoing pandemic due to the disruptions of global public health and economy. We hope to be able to come up with suggestions concerning how the global community could potentially modify their strategies in order to successfully attain these goals in due time. Finally, we are planning to reach out to more people from other countries in order to add diverse perspectives to our dynamic website and gather stories from all around the world about challenges related to the COVID-19 pandemic. Therefore, if you are or are in touch with any healthcare professional or any current or former patient of COVID-19, we encourage you to reach out to us through our website and get involved in our project. Thank you very much for your attention, and we welcome any questions that you may have about our project.
Thank you.
Yeah,